The Philippine Hospital Association says that some hospitals are facing a dilemma in accepting new COVID-19 patients. That's because of a PhilHealth memo circular that limits COVID-19 packages based on severity and prohibits hospitals from collecting co-payments. Now, to give us his insights, Dr. Jose Rene De Grano, President of the Private Hospitals Association, is now joining us live. Good afternoon, Doc. Doc, first off, can you explain to us what co-payment is in this case and what could be PhilHealth's reason for prohibiting co-payments in all COVID-19 inpatient care packages?
Yes, so usually if a patient is admitted as a COVID patient, let's say, for example, just a mild case, then whatever expense that he makes during his confinement, let's say for every, usually he is confined for 10 to 14 days. If he has 100,000 expenses, PhilHealth will only pay 43,000. And supposedly, whatever excess from PhilHealth should not be charged to the patient. Then who will pay for that? That is what they call as no co-payment, because the co-payment should be in excess of the PhilHealth case rate. So who will pay for that? The hospital? The hospital is can't afford to spend for all those things.
So that basically is a reason for the pushback here from the Philippine Hospital Association.
Yes, actually, that is what the Philippine Hospital Association, of which we are also a member, they want to stop that ruling or that circular that says that if you are a COVID patient, then you'll only pay, or if you're there should be no co-payment. So whatever you spend in the hospital should be covered by PhilHealth. But PhilHealth will only pay a certain amount.
Sir, a co-payment, the availability of co-payment would guarantee 100% coverage from PhilHealth.
No. PhilHealth will only pay a certain amount. Let's say for mild case, even if the expense, even if the patient spends 100,000, PhilHealth will only pay for 43,000. That is mandated. 100,000 less 43,000 should be the excess of PhilHealth. Then that should be covered supposedly by the patient. The problem is if there is no co-payment, then the hospital should not charge supposedly the patient.
Okay, got it.
So who will pay for that? So who will pay for that?
Now, Dr. Jaime Almora as well, of PHA, told us that the circular has made admitting patients more challenging financially. What's your take on that?
Yes, of course. What will we do if, let's say, the patient will not pay the excess? The hospital, if the hospital will shoulder all the other expenses, then probably in a few days, all the resources of the hospital will be used up. And so the hospital will eventually stop operating.
True as well that, but is it true as well that some private hospitals choose not to accept patients and instead refer them to other facilities because of this financial woes?
Actually, in government hospitals, they should not have that problem, because in government hospitals, usually they really they only accept the PhilHealth payments, and there should be no co-payments. The problem is with the private hospitals, because private hospitals do not get subsidies from the government.
But is this an existing problem now, at least for private hospitals? Do they actually turn away patients?
No. Actually, we don't turn away patients. But then, of course, some patients would like to usually share the expenses. For example, if the hospital do not have the medicines that will be needed by the patients, then the patient shells out and probably buys their medicines so that they can be given the medicines for treatment.
Now, what does your current data on hospitalization say? Can you disclose to us your members' capacity and if they are still capable in terms of manpower?
In terms of manpower, of course, the private hospitals lack nurses right now. That is why a lot of hospitals, private hospitals, have been downsizing. Because even before the pandemic, a lot of nurses have gone out, have gone to overseas, and some have transferred to government facilities. So that's why a lot of these nurses, maybe let's say around 40% of our nurses in the private hospitals has resigned. And so that's why we cannot add additional beds for our COVID cases because our nurses are very limited.
Now, also, you have the PALA saying that PhilHealth should cover the expenses of patients in temporary tents. Do you think the agency will be able to do this?
Well, I hope they would, because who else would take the expenses unless it's PhilHealth? I think that PhilHealth is mandated to do that, to undertake the expenses of these hospitals.
Same time, you're saying that the test and isolation costs will only be covered if the facility is accredited by the agency. So what are your thoughts on that?
Well, of course, if you are not accredited by PhilHealth, of course, you cannot get any claims reimbursement. You have to be accredited by PhilHealth.
Very much for your insights. That was Dr. Rene De Grano, President of the Private Hospitals Association of the Philippines.